We've been bringing you selected posters, things that have really caught our eye. And the words that are the words of the moment are machine learning. And with me, we've got a bioinformatician. Introduce yourself, please.
Hello, my name is Naeimeh Atabaki. I'm from Lund University, Sweden, and from a genetic and molecular epidemiology group.
So you've already frightened quite a lot of people by saying genetic and molecular epidemiology, but actually you're a bioinformatician essentially, and you're using a lot of data in order to get some new insights. So tell us what you've been trying to find out.
In this particular project, we were trying to develop a machine learning-based algorithm for the diagnosis of non-alcoholic fatty liver disease. And then we have utilized data from IMI DIRECT consortium. So it has a different multi-layer of omic data. So we have genetic, transcriptomic, metabolomic, proteomic, all this data, and combined with the clinical really wide range of clinical variables, plasma biomarkers.
Huge data set, so that normally none of us could possibly get through that. So you really need the machine learning in order to be able to crunch it quickly.
Yes, that's very true. And also, aside from that, is like even if I just focus on the clinical part of data, which is not that big, but it's like it has a very wide range of it has a big variation in that the type of data. So and then analyzing that by the conventional methods, like let's say like linear regression model, which used like widely in this area, is like it's not answering properly our questions. So it's better to move from parametric analysis to non-parametric one, which like I've applied like random forest, which is a method in machine learning approaches, even to answer when I have a small data set. So it's not just about the type of the size of data, even the type of data matters. So.
And using this approach, using the algorithm that you've developed, are you able to diagnose fatty liver disease more accurately?
Oh, well,
or is this just a proof of principle?
I would like to say yes, based on this data. So I've been very actually conservative in the cross-validation, just to make sure that I'm doing training and testing in the separate data. Say what, like 2/3 of data was used for training the algorithm and 1/3 for the validation, just make sure it's there. But it works for this data set. I can't say more than that. So that's why we are going to validate our result in UK Biobank data set. Then I can say in an external data set, when you validate it, then you'll be more confident to say that yes, our tool works, and you don't need to go through the invasive tools like liver biopsy or even like MRI scans. All of them, these things can be skipped, and then we can just use like this kind of non-invasive algorithms. So even with the very basic clinical variable, you can do the prediction of, which can be used actually at the screening level, I would say. So not everyone, they don't need to go through this MRI or liver biopsy thing.
So actually, there's a revolution in medicine coming along. I mean, it's not just all the omics and the genomics and the proteomics, but actually it's applying machine learning to make the most of that information. And I think we've only just begun to see the start of it. And you raise a couple of really important points, and one of those is having the data to train the algorithm on. And that's a really important point. And it requires access to things like UK Biobank and other sources. Is that an issue that you think that needs to be understood and developed further?
I don't see it as an issue, but I think it's something. It's a good tool. It's something that you can use to do really extraordinary kind of like the questions that can be answered through this a bit more sophisticated algorithms than the very conventional ones. So I see the possibilities here, but at the same time, for example, I see the problem. Maybe I can give an example, which in the morning in one of the talks, that they were talking about these confounders, like which can happen in all this statistical testing analysis. But then this happens when you are working with a parametric method. So if you move a bit further, like if you work with a non-parametric algorithms, as I said, then you can even skip this. You don't need to worry that much about like confounding factors, collider bias, if you should include a variable in your model, if you shouldn't, because if you just include the wrong variable, or if you don't include the variable in your analysis, then you are going to conclude something which is not okay, which is not correct. And then another study was that, no, we see something else because, it happens because of all these confounders and biases in the analysis. So what I see as a problem is that we don't use these available methods and algorithms to draw a better conclusion, which that's what I see as a problem.
So there you have it, algorithms coming to a clinic near you and coming very fast, I suspect. Now you can find that presentation, of course, on EASD.org.